We all have hemorrhoids, but that doesn't mean we all have hemorrhoidal disease. This means not every symptom affecting the anorectal area is caused by hemorrhoids. Recently, I read the comments on YouTube saying that hemorrhoids are very painful, which is not true. The truth is that if you have anal pain, be careful. This is likely not due to hemorrhoids, but other disease. An incorrect diagnosis leads to unnecessary and mistaken treatment. Over the next minutes, I will briefly speak to you about hemorrhoids. What are the causes of hemorrhoidal disease, the main symptoms, the classification and the treatment of hemorrhoidal disease? I am Dr. Jesus Macias, general and colorectal surgeon. I like creating videos about medical topics based on medical research and the most recent and best evidence available. If you are interested in more similar content, consider subscribing. If you have any comments or contributions for this presentation, I appreciate your comments. Hemorrhoids, commonly known as piles, are vascular bundles located in the anal conduit, and anatomically there are three main bundles located in the submucous layer of the anal conduit, one left and two right bundles. They receive blood flow from terminal branches of the hemorrhoidal superior artery, which is a branch of the inferior mesenteric artery. Venous drainage is through the superior, medium, and inferior hemorrhoidal veins. Hemorrhoidal bundles are a normal part of the anatomy of the anal conduit. I remark, they are a normal part. They contribute to anal continence, keeping about 15 to 20% of the anal pressure at rest. They protect the anal conduit and sphincter during defecation, and they promote the closure of the internal anal sphincter and the anal conduit. When hemorrhoids generate symptoms, then we call them hemorrhoidal disease. Many causes have been proposed to explain hemorrhoidal disease, with some being more strongly associated. Among the main causes are increase in intra-abdominal pressure caused by constipation, obesity, pregnancy, chronic cough, some sports, and prostatic growth. Toilet reading, or spending more than 20 minutes on the toilet, has also been considered as a possible cause. Genetic burden is also very important, as it has been noticed that there is tendency to have hemorrhoidal disease among family members. Other causes like sedentary lifestyle, alcohol or laxative abuse, low-fiber diet, pelvic floor dysfunction, and age. Despite there being many proposed theories, most of them are speculations, and, with certainty, the symptoms of hemorrhoidal disease are the result of a combination of many different factors. Classification. Hemorrhoids can be classified in different ways. According to their relation with the dentate line, they are classified in internal, external, or mixed. Internal, located above the dentate line, and external, located below it. This is important because internal hemorrhoids are the main cause of symptoms. They can't generally be seen on plain sight because they are located inside the anal conduit. An anoscope is required to be able to see them and diagnose them. Only if there is mixed disease of they are grade 3 or IV, they can be seen on plain sight. Precisely speaking of the grade. Internal hemorrhoids can be classified in 4 grades based on the prolapse grade. Grade 1 is the mildest, and grade 4 is the most advanced of the disease. The importance of this classification is that it allows for treatment guidance. Grade 1, they bulge towards the anal conduit, but they don't prolapse. Grade 2, prolapse beyond the anal conduit with spontaneous reduction. Grade 3, they bulge beyond the anal conduit during physical efforts and require manual reduction. Grade 4, they cannot be reduced, and they constantly prolapse. What are the symptoms of hemorrhoidal disease? It can be only one or the combination of the following. The main symptom is bleeding, which typically is bright red. It can be scarce or so important that it can be seen dripping in the toilet or when whipping. Bleeding generally presents after defecation. It can vary in frequency from once a month to once or twice a day. It can even cause chronic anemia due to the constant loss of blood. Bleeding presents without pain. Prolapse manifests as the sensation of a mass, bulging or foreign body protruding through the anus after every bowel movement or permanent, which generates discomfort or itching in the area, presence of mucus or uncleanliness despite adequate hygiene of the perianal area. It generally indicates a more advanced stage of the disease. Pain is not a feature of hemorrhoidal disease, as I already mentioned. Bleeding is painless. In fact, if there is bleeding and pain, we should consider other diseases like anal fissure, abscessed anal fistula, penile abscess, or even cancer. The only hemorrhoidal condition that causes pain is then they get thrombosed, generally complicating the external component, but may involve the internal component. The pain of hemorrhoidal thrombosis is intense, sudden, constant. It's accompanied by swelling of the perianal area. Physical examination allows for an adequate diagnosis of this clinical presentation. The diagnosis of hemorrhoidal disease is a clinical one. It requires experience to identify anatomic structures, classify them regarding location and prolapse grade, and specially differentiate it from other anorectal diseases that may simulate hemorrhoidal disease. Although the diagnosis of hemorrhoidal disease may seem easy, it requires experience and an adequate physical examination. Finally, the management of the disease has to be based on the degree of the symptoms, prolapse, and complications of the hemorrhoidal disease. For practical purposes, I summed it up in 3 treatment options: medical, non-surgical, and surgical. Medical conservative management is preferred in earlier stages of the disease. It consists in managing constipation and changes in defecation. A high fiber consumption is recommended with an adequate water intake. Fiber is found mainly in fruits and vegetables like broccoli, cauliflower, celery, peas, artichokes, avocado, carrots, kiwi, oranges, pears, and raspberry. Some legumes like chickpeas, lentils, beans, cereals like oats, wheat bran, and wholemeal bread. Adequate water amounts must be consumed throughout the day. These diet adjustments favor the formation of soft stool, generating a minimal effort to defecate it. In some patients with functional constipation, fiber input in the form of psyllium plantago may be considered. If constipation persists despite these dietary changes, I recommend to have a consultation with a proctologist or a gastroenterologist to rule out other diseases that can cause constipation, and a personalized treatment may be established. If you are interested, other useful measures for the conservative management of hemorrhoidal disease are: avoid toilet reading. The toilet should be used only for bowel movements, not to check Facebook, Instagram, or even YouTube. The time spent on the toilet should be under 5 minutes. The defecation posture must be corrected. In several studies, it has been demonstrated that the squatting position is associated with a quicker and more effortless defecation than the sitting posture. Or leaning while being sat, the thinker posture, promotes the opening of the anorectal angle. To achieve this recommendation, putting a small bench in front of the toilet is suggested to favor the proper angulation of the anorectal angle. Sitz baths are also recommended, as they decrease inflammation, itchiness and burning sensation, edema, and in the case of hemorrhoidal thrombosis, they also decrease pain. They favor an adequate perianal hygiene. They consist in placing a small tub inside the toilet called sitz bath that is filled with warm water with no other substances or powder. The person sits for about 5 to 10 minutes, allowing cleansing of the perianal region, after which the person gets up and perfectly dries up. Depending on several factors, they can be done twice or thrice daily. I do not recommend sitz baths for over 15 minutes, as they can cause dermal lesions and generate discomfort. Being a very frequent disease, there are many medications in the market to treat it, most of which have not been evaluated in clinical trials, and that's why they are not recommended. There are many brands with a lot of publicity, but no proven effectiveness, that can even be damaging and make symptoms worse or affect your health. I also reviewed some comments in social media, YouTube, of people sharing their experience with the use of corn syrup, hot sunflower seeds, aloe vera, bee therapy, cooked rice poultice, vapor-rub, toothpaste, gasoline, dog salive. I do not recommend these substances because they don't work. The use of any of these are complete responsibility of whomever consumes them or uses them. According to evidence, the use of topical substances, meaning creams, suppositories, or any treatment placed in the anal region, has not shown any benefits for treating symptoms of hemorrhoidal disease. The recommended management is a systemic one, by mouth. Very few medications have shown to be useful for managing hemorrhoidal disease. Medications like 𝗛𝗘𝗠𝗢𝗥𝗥𝗛𝗢𝗏, which contain flavonoids, have demonstrated to improve symptoms, decreasing bleeding, edema, and local discomfort. Because of this, their use are recommended. Non-surgical interventions include ligation with elastic bands, sclerotherapy, infrared photocoagulation. Such procedures are considered for grades I, TI, and III hemorrhoidal disease. They can be performed in a consulting room or in the operating room and require specialized material and experience to perform the procedure. Surgical management of the disease is hemorrhoidectomy, the standard procedure indicated in patients in which other treatments have failed, those who have recurrence of the disease, or in advanced stages of the disease such as grades 3 and IV. There are multiple techniques, all very useful, and there are no differences in the outcomes. Choosing one depends more on the clinical condition of the patient and the surgeon's preference. Surgery definitively has great results, very low recurrence rate and low complication rates. However, it is associated with marked postoperatory pain. I recommend avoiding self-medication and the use of magical medications against hemorrhoidal disease. Definitely the medical and the surgical management have to be personalized and be done by a medical expert in hemorrhoidal disease, preferably a proctologist. I truly hope that this video has answered some doubts about hemorrhoidal disease. If you have any suggestions or if you would like it for me to speak about any specific topic, let me know. You can follow me on my social media where I publish updated medical information. I invite you to share this video with a relative or a friend to whom this information might be useful. Thank you very much for watching this video. I am Dr. Jesus Macias.